On July the 19th, we expect that the final restrictions will be lifted and life as we know it should return to normal without COVID restrictions. However, the situation in Torbay has changed dramatically over the last 2 weeks. And we now have some of the highest rates of COVID that we have ever experienced since the pandemic began. In fact, our most recent statistics puts our 7-day rates at 348.6 per 100,000, which is much higher than we saw in mid-January as we were experiencing the last peak that we're currently coming out of. At that time, the rates peaked at 266.4 per 100,000. The point that is important for us to note here is that that is driven largely by infection in people who are under 40. In other words, by the cohort of our residents who have not yet been fully vaccinated. In fact, the rates are very low in those who are over 55, where over 90% of Torbay residents have had 2 doses of vaccine. And so when we look in detail at these increases that we have seen over the last few weeks, it's largely driven by people who are, as I said, under 40, and in particularly the young working age population, under 30. In fact, the rates of those between 20 and 39-year-old is almost 1,000 per 100,000 7-day rates, and increasing day on day. In fact, we've had days when we've had over 100 new cases, and that's the first time we've seen that in the Bay. Clearly, there is a challenge. Largely, our vaccination rates have protected our older population and those who are more likely to have severe disease with COVID. And thus far, we've not seen very many new hospitalizations, and thankfully to date, no new deaths have been recorded. However, this is early days, and we would expect to see those impacts coming through in the next 2 to 3 weeks. We do not expect that we are going to see large numbers of deaths, certainly not as we have experienced in previous peaks, because of the protection of the vaccine program and because of the vigilant work that we're doing in care homes, for example, to prevent outbreaks in those settings. However, our hospital is already under pressure, and it doesn't take very many hospitalizations to cause them to have problems in terms of being able to get back to normal and to begin to deal with the backlog of cases, the non-COVID type activity that the hospital is desperately wishing to get back to. And so any additional hospitalizations, even if they're in small numbers, are likely to increase pressure there. The impacts, however, have been largely around the economic sector. It's important to note that the vast majority of our employers in the Bay have been responsible. They have worked very hard to ensure that their operations are COVID safe. And in fact, when we look in detail, we see that relatively few cases have resulted from transmission in workplaces. The majority of cases that we're picking up that have a workplace link are typically contracted through people's social contacts outside of work, through their household contacts, and that has a knock-on to the businesses. Unfortunately, a number of businesses have had to close because of cases that have developed in their staff or because their staff are contacts of people who have tested positive for COVID. So that is where we're seeing the impact across our hospitality or tourism sector, across our health and social care sector, where many people have had to self-isolate because of COVID. And that's causing a problem in those businesses being able to function in the way that they would want to. It is true that the risk of severe disease is much lower in younger age groups. However, that risk is not zero. And it is important to emphasize that when the background rates are at the levels that they are and increasing, it means that more people are likely to develop complications even in a low-risk age group. So it's important to advise our young people and to ensure that they continue to behave responsibly so that they don't spread the virus to their friends in turn who may spread it into their households, and that they get vaccinated as quickly as possible. We know that the vaccines are safe. We know that they are effective. We are seeing that in our statistics as we monitor the situation. A number of drop-in sessions are being planned for the Riviera International Center, which is one of our main vaccination sites. You do not need to pre-book, so it's important to make use of those and any other opportunities that we will be working with our local NHS partners in providing opportunities for young people and others who have not yet been vaccinated to have their first or second doses of the vaccine as quickly as possible. We know that restrictions are being lifted, but as I said before, the situation in Torbay suggests that the background rates are quite high and continue to increase. And that means that our social activities or interactions with others that might have not caused a problem a few weeks ago now increases the risk that we could become infected. And therefore, it's important that although the restrictions are lifted, that we act responsibly and we act in ways that will reduce the spread and help us to control the situation and get back to normal as quickly as possible. As I said before, it is important that we encourage people to come forward to have the vaccine as quickly as possible. If you've been booked for it, please come forward. If you've missed an appointment, please rebook or come into one of those drop-in sessions. It's important that people are tested. If you develop symptoms, then it's important that you have symptomatic testing done. We recommend that people do not use the lateral flow tests if they have symptoms. Those are tests for asymptomatic spread. And it's important that if people have symptoms that they get the PCR test done as quickly as possible. We would want to encourage particularly young people to work with us in NHS Test and Trace to identify contacts. If you are a case, you will be contacted. We will work with you to try and understand your risk of transmission to others, to identify anybody who might be at risk so that they can be tested and they can be isolated. This is very important for us to be able to stop the infection in its tracks and not allow it to continue to get out of hand. We recognize that there are a number of people who, for a variety of reasons, some of which may be medical, are unable to have their 2 doses of the vaccine, or who may not mount a full immune response that would be protective. We know that there are groups who are clinically vulnerable. And Because the background rates are increasing, we want those people to be aware of that and to take the necessary cautions over the next few weeks to protect themselves from becoming infected or from having consequences of infection. Where possible, we want to encourage people to continue to work from home. We know that the restrictions have been lifted and the expectation is that people will go back into the office. However, we want to ask employers to do that risk assessment, and where you have staff who can continue to work from home, that you allow them to do so and that you work with us to ensure that we do not have people mixing in the workplace who do not need to. We have enough sectors that are dependent on face-to-face staff working with their clients and customers as much as possible, where we have other staff that don't need to work face-to-face, that they are allowed to do so while the background rates continue to be high. And no doubt there will be messages that will emphasize the importance of continuing scrupulous hand hygiene, the use of face masks and face coverings when people are indoors in enclosed space. We want to emphasize those messages. Although there are no requirements by law for you to wear face masks in stores, in enclosed spaces, we want to encourage you to do so as a responsible and sensible thing to do to help reduce the rates of infection. We also know that meeting in smaller groups, meeting outdoors, reduces the risk of transmission. So we want people to socialize. We know that people want to come together and meet their friends and meet with different households. But as much as possible over the next few weeks, while the background rates are high, we want to encourage people to limit the size of those gatherings. Try not to meet with too many households. And if you are, try and meet in an outdoor space that will reduce the risk of infection. If we work together, we can quickly get control of these infections that have been increasing so rapidly over the last few weeks. Most of this, as I said before, is due to our social contacts, is due to transmission in our households. And therefore, that is where our focus has to be over the next few weeks in terms of what can we do that limits that spread, that interrupts that transmission, and gets us back to a point where we can fully enjoy the freedoms of the restrictions that have been lifted. If we act responsibly, if we act together, we can protect ourselves, we can protect our loved ones, we can protect the visitors who come into the Bay. And together we can continue to have a safe and responsible route into normal life. Thank you so much.